Volunteers, health professionals and the local community all have a role to play in helping patients use and make the most of digital ways of keeping Norfolk healthy. Those are the key points that emerged in a new report just published by Healthwatch Norfolk. We were asked by NHS Norfolk and Waveney to look at digital access and tools like apps and websites and how they can help in healthcare. For the second 12 months of this 3-year project, we focused on raising awareness of the different digital options and ways to help patients learn and understand how to use them. We were also asked to find out how GP surgeries are using digital methods in an innovative way to help people and ensure we have the information we need about shared care records, which mean medical professionals all have access to information and patients and families don't need to keep repeating themselves. We did this by co-hosting an online event for GP practice managers and the community about the digital health hubs, which means people can go into libraries and get help accessing health information online and using the NHS app on their phone. Finding out about GP surgeries around Norfolk who are using digital technology in those innovative ways to help patients. We found the digital health hubs were really helpful to people, particularly if they'd never used a computer before, and the assistance was closely tailored to the person's needs. And some of the surgeries using technology in new ways included Grove Surgery in Thetford, which used QR codes that patients could scan on their phone and get access to useful health information or documents such as forms they can fill in to record their blood pressure. Trinity Street and Bothorpe Surgery in Norwich, whose patient participation group looked at the footfall computer system used by the surgery to see how easy it was for patients to use and whether some of the language needed to be changed. They then presented their findings to NHS Norfolk and Waveney. Aldborough Surgery in North Norfolk, which evolved its patient participation group by linking with local charity Village Care to collect people's views, and it set up a special area on its website to keep patients up to date with what's going on at the surgery, host surveys and receive feedback, and provide health and well-being tips. Healthwatch Norfolk found that using these digital methods and promoting them could help both patients and healthcare staff in many ways, including accessing help, ordering and managing prescriptions, managing long-term health conditions, and just aiding communication between patients and professionals. Based on its work, Healthwatch Norfolk is making the following recommendations. The NHS digital team should link in with support workers, social prescribers and community connectors across Norfolk to promote the digital health hubs in libraries. Explore training and nominate a digital champion within GP practices or patient participation groups. Encourage GP practices to share these innovative examples of digital tool use. Ensure that any digital innovation is evaluated to make sure it works well for patients and they're happy with it. Make sure there's regular liaison with patient participation groups to make sure people can access communications materials, and also make sure these groups are involved in their research and feedback. Create a straightforward, accessible guide to the NHS app. You can find out more and download the report here.